This is a case report of extensive hidradenitis suppurativa managed with a multidisciplinary and multimodality approach. Hidradenitis suppurativa or acne inversa is a chronic recurrent inflammatory disease affecting the skin-bearing apocrine glands. It usually manifests with the formation of abscess that can be complicated by rupture, chronic malodorous discharge, sinus tract formation, scarring, and scar contractures. It usually and predominantly involves the axilla, groin, perineum, buttocks, and inframammary regions. It is most commonly seen associated with obesity, smoking, autoimmune disorders, inflammatory arthropathies, and inflammatory bowel disease. This is a case report of 36-year male patient, Maldivian, who presented to the OPD with a complaint of pain, swelling, and pus discharge from bilateral axilla, inguinal region, and over the buttocks, predominantly over the left side. It was on and off for the past 15 years, but was associated with pain and aggravated for 2 months before the presentation. He is moderately built and nourished with no urinary or bowel symptoms. He is a chronic smoker and alcoholic. Local examination showed severe grade of hidradenitis suppurativa of the buttocks extensively spreading over the groin, scrotum and inguinal region with multiple tender discharging sinuses. On examination of the axilla, multiple discharging sinuses were involving both axilla, predominantly over the left side and is associated with the nodules. There was a restriction of movement around the left shoulder with abduction possible only up to 90 degrees. Imaging was done. MRI pelvis shows extensive areas of inflammatory changes with multiple small abscess and fistulous tracts involving the skin and subcutaneous tissue in the bilateral gluteal region extending up to the perineum, inguinal region, and the scrotum. This is MRI pelvis showing a sinus tract in the right gluteal region at 7 o'clock position, reaches up to the distal end of the anal canal, but with no internal opening. MRI axilla showed extensive inflammatory changes with diffuse thickening of the subcutaneous tissue involving the axilla and extending over the chest and medial aspect of the arm. The lesions were seen abutting the axillary and the brachial vessels. He was managed by staged excision of all the lesions in toto, followed by reconstruction once the wound is adequately managed. Stage 1, bilateral axillary lesions were excised. In stage 2, the left axilla was reconstructed using a flap and the groin lesions were excised, followed by immediate reconstruction with the anteromedial thigh flap. Stage 3 was the excision of lesions over the buttock. These are the images showing the management of left axilla. Excision was done in toto, which was aided with the injection of methylene blue. The wound was initially managed with WAC because of the extensive contamination. Once it improved, reconstruction was done with the thoracodorsal artery perforator flap in VY advancement. Right axillary lesion was excised in toto, followed by immediate reconstruction with a transposition flap. The extension lesions of the groin reaching the perineum was delineated by injecting the methylene blue and was excised in toto. The defect was closed with anteromedial thigh flap harvested from the left side and with tissue advancement. He developed wound dehiscence over the groin, which was initially managed with conventional wound dressings. The wound didn't improve, so he underwent laparoscopic diversion colostomy, and the wound was managed with serial debridements and WAC, followed by SSD over the matriderm once the wound has improved. In buttocks, complete excision of the lesion was done, followed by WAC. It was closed with matriderm and SSD once the wound has improved. Hidradenitis suppurativa requires a multidisciplinary team approach and a multimodality therapy for successful treatment. Surgery is a radical treatment option for hidradenitis and may be considered as the only potentially curative recourse. Surgical excision and reconstructive approaches depend on the anatomical location, severity of the lesions, size, and the degree of wound contamination. Successful treatment improves the quality of life. Thank you.